Start.
Hello everyone, I am Dr. Bhaskar Shukla, a practicing neurologist in South Delhi. Today we are going to discuss about epilepsy. So let's discuss what is epilepsy and what are its causes. Epilepsy, we have to understand the difference between a seizure and epilepsy. So seizure is one-time event and epilepsy is an enduring predisposition to have recurrent seizures. So any patient who is having recurrent seizures, recurrent seizure attacks is said to have epilepsy. So what are the common causes of epilepsy? So there are very common causes of epilepsy like history of stroke or history of trauma or any history of infection, and rarely brain tumor may lead to syndrome of epilepsy. So there are certain childhood epilepsy syndromes also. There are certain and in the majority of cases we cannot determine the etiology, so they are known as idiopathic epilepsy, idiopathic generalized epilepsy. But all out effort should be made to determine its etiology. So what are the fears and stigma associated with epilepsy and how to overcome it? So it's a common misconception among the general public that epilepsy is because of some curse, or it's because of or it can spread through human to human transmission, or that it's because of some evil spirit. So these are not true, and it's a medical condition that requires proper diagnosis and evaluation by a qualified physician. And if we are willing to go through a proper treatment process and diagnostic workup, this epilepsy can be controlled to a great extent. So the idea is not to get swayed away by the misconceptions, by the myths, but to follow what your physician says and try to stick to the advice which your physician gives you. So there are certain misunderstandings in the public. Like for example, when a patient starts having seizures, so what are the do's and what are the don'ts? So it's a common temptation among the people that whenever they see a patient having fits, they try to put something to their mouth, or they try to feed him something, or they bring shoes and make him sniff that, and try to put something like put a finger in their mouth, etc. So these are absolutely, and very often so many people gather around the patient. So these are the absolute don'ts, and we should avoid doing any such activities. Rather, whenever you see a patient having fits, always try to clear the surroundings, ask people not to gather and make the place crowded, and try to make the patient lie down on one of his sides and never try to put anything in his mouth. The seizure will subside automatically within 3 to 4 minutes. And the area should be clear of any harmful objects like sharp objects or anything, so that the patient does not hurt himself. Putting a finger into the patient's mouth will only lead to the injury to the finger of the person who is doing that. So these are some of the things which you should keep in mind whenever you see a patient having fits. So my advice would be to first of all consult whenever you have a family member having an epilepsy. Always go to a neurologist and get a diagnostic workup done, which involves a minimum of an MRI, an EEG, and depending on the information gathered from these investigations, further tests may be required. But minimum of these two tests are required to make a diagnosis. And of course, the clinical semiology, the clinical phenomenology of seizure is very important to make a diagnosis, to classify the seizures, the epilepsy syndrome, and that will guide the treatment. It is very often seen that the patients who have epilepsy often require very long-term medications in the form of anti-seizure medications. So that over the time they tend to burn out. They tend to skip the medications, or they tend to stop the medications altogether. So in these situations, the seizures will keep happening, and every seizure carries a risk both to the patient as well as to the people, other people also around the patient. For example, if a patient is not adherent to the medications, he is driving. Suppose while driving he starts having fits. So, he will meet an accident and he will hurt other people also in the process. So, this is what I am trying to say. So adherence to the anti-seizure medications is very important. You should always be in touch. You should always follow up with your physician and try to follow a regime which is best suited, because there are certain conditions which may determine the choice of anti-epileptic drugs. For example, in pregnant females, or in patients, in women especially of childbearing age, there are certain medications which should not be given. Then depending on the other situations also, like newer anti-seizure medications have also come in the market, so they are they have a better safety profile, and equally efficacious, and single daily dosing is also there. So there are so many other things, and of course the cost. We should not forget about the cost. So these all factors go a long way in ensuring the long-term adherence to the anti-seizure medications. So you should always discuss with your physician, with your neurologist, and decide. And after a mutual discussion, we should arrive at the best possible anti-seizure medication in a given situation. So that will help in the long-term compliance to the drugs. And yes, and we should make other people also aware about the condition, and we should avoid entertaining myths and other things surrounding this epilepsy. So with the proper guidance and this thing, it can be well controlled. So thank you for your patient listening.